Today we're talking about allergies. You and I may suffer from them, but pets can too. Tiffany Burk joins us this week for Animal Answers from Bay Animal Hospital. You know, dogs, cats, they get allergies too, right?
Oh yes, goodness, they sure do get allergies, not like us with the runny, itchy noses. Theirs manifest with itchy, scratchy skins, ear infections, licking and chewing at paws. But yes, they are very prone, especially this time of year, for an uptick in their itch.
Well, and just like us, I mean, you're talking pollen, dust, grasses, they can all be affected by that too?
Oh, most definitely. That is a common cause of allergies in our cats and dogs. We call that atopy or environmental allergies. That's just one of the pillars of the allergy trigger here with our veterinary patients. The pollens that are circulating in the air, dust mites or molds. There is even environmental allergies in the winter as our furnaces are turning on. That'll cause our pets' immune system in their skin barrier to be broken down.
That's no good.
It's bad.
It is bad. So let's talk about what you can do about it.
What you can do about it is keep a little journal at home for your pet, because when you come in with your pet to the veterinary office, we're asking leading questions and a history. When did it start? What did you first notice? And is there a seasonal component? Because dogs have allergies to other things besides what's outside their body, such as food. So when we're deep diving into what's causing your pet's allergies, we're really listening to what's going on all year long, whether it's spring or fall, or if we're having a non-seasonal component. These symptoms are going on all year round, and if that's the case, then we might be using our microscope to look at a different causative factor.
Yeah, so pay attention to what's going on with your pet.
Most
I think we have some
definitely.
video here of Jimmy the puppy, right?
Yes.
What symptoms did old Jimmy come in with?
Well, Jimmy came in with the most typical call we get: itchy, scratchy skin, and he was very well distracted for our exam with some cheese because we want our pets nice and happy. He was licking and chewing at his paws and just starting to scratch at his ears. So even if they don't look red, they don't look like there's a problem, please call your office, because we want to make sure at the animal hospital and your veterinary office that we can catch it before it becomes a major skin problem, like a hot spot or a major ear infection. And Jimmy was such a good patient. He was eating
He's more than happy.
body weight in cheese, let me tell you. And this was a pet we actually saw yesterday who came in for just a routine vaccine appointment. And as we're looking under the lips, we're noticing not a problem there, but we lift the ears and we noticed a pretty severe ear infection.
Oh,
so
poor
what
fella.
we did is we brought him in the back, we cleaned his ears out for the owner, because sometimes that can be quite a challenge at home, getting deep down in that horizontal and vertical ear canal, getting out all that debris, because you can't medicate on top of the debris. We instilled a medication that'll last for a full month, because some pet owners can't medicate at home. And at Bay Animal Hospital, we have a couple of different options in our tool belt, if you will, that we can treat ear infections with.
Okay, so just besides the ears, so what are some other general treatment options that people
Yes.
can do for their pets?
Well, there's a new medication out on the market, and I shouldn't say new, it's been out there for some time. It's called Apoquel. It's a medication that innervates the itch scratch pathway different than a steroid. It downregulates your pet's secondary problem, itching. It's a medication you can give daily during allergy season. There's medication that is very similar, that's an injectable version. A lot of times with allergies, though, we treat them topically. We treat ear infections with topical ear medication. If there's a skin infection, we'll send home medicine by mouth to treat the bacteria that is overpopulating the skin. Treating yeast infections with medications like ketoconazole. There's a lot of different tools that we use, whether it's by mouth or topical, to make each pet comfortable for their specific needs. And we also listen to pet owners. Are they able to medicate at home? Can they get those meds in? Because owner compliance is very important.
So bottom line though, check with your vet if
Yes.
you see some of those symptoms she talked about, and they can lead you in the right direction.
100%.
As always, we thank you for your insight, and you know, we'll see you next time around for Animal Answers, right? There's more information on your screen as well about Bay Animal Hospital, and tell Jimmy I said hi.
Oh, I sure will, Matt. Thank you so much.
Kevin?